initially, because I was struggling to see how climate justice would link to childcare, and I think you did a really good job of showing how if we're going to change one part of society, we've got to change it all, and we have to bring in that equality and social justice, and for all of us to create a sustainable planet for the rest of us. And it does start with education from the early years. So thank you for making that link, because I didn't see it, so thank you for that. I'm delighted to welcome the panel here, and I'm going to start by asking each panel member, and I'll introduce you as I'm asking the question, but I just want to ask you to give maybe a 2 to 3 minute presentation on what the question is here today and what your vision is. And I'm going to start, if that's okay, with Darragh O'Connor. And Darragh is the Head of Strategic Organising and Campaigns for SIPTU. He's worked as a union organiser for over 14 years in the public, private and C&V sectors. I will say Darragh and I have been going to meetings on this together for at least a decade, so it feels like, yeah, we need to get progress from now. Darragh, it's time to do something about it, okay? And most recently he led SIPTU's campaign to unionise early childhood education and care for professionals. The ambition of the campaign is to transform ECEC so that it is high quality for children, affordable for parents, and where workers are recognised and rewarded for their professionalism. After years of campaigning with the Board Coalition, an historic first pay deal was reached in 2022, and that pay deal was underpinned by significant increase in state investment and lifted thousands of workers out of pay poverty. So Darragh, could you just give us your first reflections for the next couple of minutes?
Yeah, thanks Louise. So I work for SIPTU, as Louise was saying, and part of that is the Early Years Union. And you'd like to say, I shouldn't be up here. I see 2 members of our national committee, one former member of our national committee who are early years educators, people who actually make the, should be making the decisions, who are well able to talk. So the next time I get an invitation, I'm likely declining and having the workers up here instead of myself. And I think they serve, because they can tell you about the lessons that we've learned. Because we've been at it for a long time, but change is possible, because we've actually achieved quite a lot within early years, and we'll talk about all the problems, and they are significant. But we can't kind of deny the progress that we have made, and a lot of people within the union and lots of other organisations, including the Women's Council, have been instrumental in bringing that about. Because we have been able to get investment to over €1 billion a year in early years. That was a kind of a key demand. We've been able to achieve that within 4 years. There has been a reduction of fees for parents. It's still way too expensive, but the National Childcare Scheme is having an impact. It is, and anecdotally, you talk to, I have kids in crash, I have friends with kids in crash, where people do talk about how this is changing things. And certainly, the rates of pay have gone up for educators. There's still a recruitment and retention crisis in the sector, but for the lowest paid workers have seen pay increases of 50%, 60%, 70%. Wow. Quite transformative. But it speaks about the exploitation that was going on in the sector, where you had people with degrees on minimum wage for the last 20 years. Completely unacceptable stuff. But certainly we have seen some progress there. But there are huge issues. I think a part of it is that certainly we have a market-based system. And that the problems that causes are thrown up in lots of different ways. So in my kids' crash, Sarah is the chef. She's fantastic. I love her to bits. And she also says to the kids, you get what you get and you don't get upset. Right? You might as well say the same for childcare. Right? You get what you get. There is, and Helen Penn was talking about earlier, about the engagement of parents on a collective basis with providers to be able to talk about what is the policies that they want, what kind of how the place is going to run, all that kind of stuff. Never mind, the qualifications of staff that Helen talked about. How about a conversation about what type of service is needed, whether parents and children need full day care or sessional or after schools. No one has control. Never mind the parents. The state doesn't have any control over that at all. The basis of setting up a service in this country is, can you make money or not? That's it. Right. So the lack of the supply issues that are there is because the state takes no active role to date, has no active role in determining what are the services that children and families need, and let's go and provide them. It's just completely left up to individual providers, right, for So that's one piece. There's a supply side issue that the state needs to step up. There is still a recruitment and retention crisis, chiefly driven by low pay, but not exclusively. There are high levels of stress within the sector, and we see there's a bit of a negative feedback loop here where we have services are struggling to hire staff, so they operate out of ratio, so there's not enough staff on the floor to be able to do it. That's a really stressful situation, so people they look for careers in other parts of the sector or outside the sector completely. So that's a real big problem. Limiting supply, because if you don't have people to man or run the services, right, they're not going to be delivered. That also really has a big impact on quality, because if we have a high turnover of staff, that impacts quality for children, because it's based on the relationship between the educator and the child. If someone's there, if one person in every 6 months, that's a problem. And then we have the creeping corporatisation of childcare as well. Private equity funds, big money kind of coming in, and the chains are expanding. So in short, we need a new model, and there are gaps there. The commitment for €200 a month childcare fees that the government has made, right? The current leaky bucket funding system will not deliver €200 a month. There's an opportunity there to radically reform the sector. And the second commitment that the government has made is to publicly led childcare. So that's the other one. We need to hold their feet to the fire, because I think when they make commitments, it's easier for us to be able to make progress. You know, we've got to make some lemonade. That was a nice little quote there as well. And that is about having a clear, unified campaign where we're able to keep the feet to the fire of government, but also as much of the sector as possible to be singing from the same hymn sheet and have a clear and consistent message.
Great, that's brilliant. That was nicely summarised of all the problems and so thank you for that. I'm going to turn over to Maria, if that's okay with you, Maria, and I'll just explain who you are. Maria is the coordinator for the National Travellers Women's Forum for the last 13 years, and is a long-time activist for human rights and equality for traveller women and the traveller community as a whole. Maria has strived to inform traveller policy development and wider gender policy at national and international level, and I don't think there's anything more gender policy than having adequate child care, so with you on that. Maria has also been part of the campaign for traveller recognition. So do you want to start?
Thanks very much. And can I just say before I even start, I have a nice little one-pager all done up for my opening statement. But I was here in the earlier part this morning, but I had to leave to go to the Department of Housing for an NHAC meeting, which is the National Action Committee, National Homeless Action Committee, which was to start at 11 and was pushed back to 12. So my apologies. And in the midst of their paperwork and a little bit of paperwork I had for this, my nice one-pager of polished context is gone. So you're going to depend on the brain power here. And I can tell you, having run from the department here to get here in time, it's operating now on stress levels. But basically, if you're asking in terms of what we would like to see, and I suppose in terms of the context of the National Traveller Women's Forum and local traveller organisations who make up our membership along with traveller women's groups, I mean, it has been a long time strive towards a publicly funded early education and care system, underpinned by a social justice approach that would ensure, equality of access and equality of outcomes for all children, and in particular, we'd be speaking in relation to traveller children in that context. Traveller children do not begin their educational journey on an equal footing. In terms of the statistics that's currently there in relation to the numbers of children in early years education and care, 92% are from the general population. That drops back down to 74% of traveller children within the early years education and care system. And that, I suppose, there's a number of factors in relation to that, but I suppose the overriding context it's underpinned by a systemic form of racism. And when you're looking at poor housing and accommodation, when you're looking at intergenerational exclusion, and you're also looking at intergenerational inequality of outcomes in the context from the education sector. We also see in the context of, you know, families reporting that they've been refused places, particularly within private providers. We also know that, you know, there are Trumper families having to go to early year care centres, trying to hide their identity and hide the identity of the child to just secure a place. And also the lack, I suppose, of, even within the early years and care section, that visibility of travellers, but also in the wider kind of curricula, the invisibility of travellers across the board. So those are just sort of some of the kind of aspects that I suppose inform some of that. Also, I just wanted to flag, and I hear what, sorry, it's Darragh. I hear what you're saying in relation to the levels of investment that have gone into this sector. But I suppose when I was listening to the keynote speaker this morning, before I had to rush out, I mean, Ireland is the lowest in terms of spend in Europe, below, you know, just over 0.5% in GDP versus, you know, 1.8 GDP of the highest. And I suppose you're not going to get a quality publicly funded early years sector if you're not going to invest in it to the levels that it needs to be invested in. And I suppose that is the context of this whole conference in terms of that. Ireland as outliers in terms of the context of Europe. And I mean, there are numerous countries within the EU that have free, fully funded and free early years education system and, you know, education activities at that age. So I suppose that's what we need to be striving for. In terms of the ECEC scheme, access to the scheme for unemployment, you know, in terms of unemployed parents. Unemployed parents are only entitled to 20 hours of early years education compared to 45 hours for employed parents with travel on, you know, and that is a really significant barrier. When you're looking at the higher levels of unemployment among travellers, and I think the most recent census puts that over 60%, but also in terms of the levels of unemployment, of secure employment, and sustainable employment in terms of traveller women. I think that is a really telling factor. And again, that goes back to the supports and the resource not following the child, but following the service. And again, keeping families from lower socioeconomic backgrounds on the back foot. And just let me explain in a really practical way the impact of that. There's two recent scenarios in just discussions with traveller women that I've had, and one with a Roma woman, where the mothers of those children were in part-time employment, but more than the hours that the free ECEC scheme provided. And because the providers, particularly the private providers, will go for the full-time parents who are leaving the children in full-time, one could not secure a place for her child on a full-time basis. One also had to rely then on, again it was there this morning, and the family are a key role, and have always been a key role, an extended family, in supporting and, you know, not just the childcare, but nearly the child rearing. But when you have to look to a whole load of other people to try and pick a child up from school because you're going to be 2 hours back later here, all of that really adds in. One young woman actually had to turn down a job that she had gone after because the local provider would not allow her the extra hours that she was prepared to pay for, but couldn't afford to pay for full-time care. And then that meant that she didn't have family support around her at that time, so she couldn't take up an employment position. It also impacts on the training opportunities for women. Traveller women intersect with higher education, and there's not enough of it, but they intersect with higher education at different stages than maybe settled women. And some of them will have their family, some children, because they start their families younger. So the importance of, you know, an early years care and education system that will facilitate that going back into education and training for traveller women is really critical in this. And I suppose, as I said, I would have had a more coherent a few points made, but I will finish up soon. And I just wanted to say as well, I suppose targeted action alongside mainstreaming, that point I made earlier, that not all children are at the same starting point, or, you know, in terms of it. So it's so important in terms of that targeted action alongside of mainstreaming. And as part of the discussion, I'm sure other issues will come up around, you know, proper women employment and within the early years sector, particularly private providers, but the training piece as well and the qualification piece was the other bit in that. I'm going to leave it there. I think the data piece is important as well, but we can pick that up in some of the discussion.
Thanks Maria. But I think what I really got from there, and it's gone back to something Jenny said about, you know, equality, a more equal society. And when you talked about lower participation rates from such an early age, that children are starting already that unequal divide, and that their participation rate is only 74%. That is quite shocking, that we start to see inequality from infant age, you know, and that's really shocking. And then the other thing that really struck me was, you know, we say that we want all children to be treated equally, but you made a very stark point there that the child's right to equal care is based on a parent's status. Now, a parent's working status. Now, a parent's working status is already probably going to elevate the child above other children anyhow. But then you're doubly compounding that by saying that child is not going to have her 45 hours of early education and care. So 2 points really well made, Maria. So thank you for that contribution.
Just add to the point of the point you're making around the gap already at the
exactly.
I mean, when you think then the knock-on impact that has on lifelong education and learning.
Oh no, I mean that's it. You're starting.
That what you get there in the foundation is key to how far you advance as well.
Yeah.
So that's an important thing.
Yeah, no, thank you, Marie. That's really well made. Thank you for that.
So sorry for my own very incoherent.
No, it was very good. Thank you. I'm now going to call on Alex Brennan. She's the coordinator of the Northern Ireland Women's Budget Group, and I'm delighted that Alex has come down because it's great to have the Northern Ireland example here. She scrutinises policy and budgeting matters with a gendered lens to bring attention to the different ways in which women and men are affected by government level decision making. The ultimate aim is to secure a gender equal economy in Northern Ireland. Prior to coming to the role in October 2020, she completed her MA degree at Queen's University, Belfast, and has worked in various media and communication roles in the US. So I'll hand over to Alex.
Cheers, thank you very much. I'm really happy to be here and just want to say thank you again for inviting me onto this panel. Like was mentioned, I'm the coordinator of the Northern Ireland Women's Budget Group, and we bring gender perspective to economic and fiscal policy making, particularly in the north as our focus. But I thought I'd maybe, so I don't know how familiar people are. I know sometimes in the north people aren't aware of the childcare situation in the south, so I thought I'd outline sort of what the childcare situation is in the north and some recent updates and sort of our vision for what it could be like, and hopefully that's something that the campaign or the sort of network in the north and the network in the south can be working to strengthen each other's movements. So there's actually no free childcare provision in the north. There is tax-free childcare, but only for families with someone in work, and that kind of goes back to that, that really impacts particularly on families that face a number of different disadvantages, and parents still have to pay upfront. And the average cost of full-time childcare in the north is about £1,000 a month. So for so many families that are already struggling financially, paying upfront isn't an option. They can't wait for government money to come in after the fact. There has been a subsidy scheme that was only recently introduced in 2024, but the uptake for it has been quite slow. And in the previous autumn budget in 2024, the increase to employers' national insurance contribution has sort of increased the cost of childcare, which we supported the increase to national insurance contribution, but with the caveat that they support community organisations and sectors that already don't get any sort of investment like the care sector. So this has significantly decreased the impact of the subsidy, as the subsidy is now covering essentially what the increase in childcare costs have been following that. And it's actually just interesting to hear what the investment in childcare is in the south, because just last year in our budget, we had the first time ever childcare featured strongly, and it was only £55 million, and 23 million of that went to the subsidy scheme. So it was really, really minimal investment in the north in childcare. Informal childcare, which has already been mentioned, is really, really popular as well. About 1/3 of families use grandparents or relatives as their main form of care, which, we've already kind of discussed the gendered impacts on parents performing childcare, but there's so many additional impacts with grandparents and other relatives, particularly grandmothers and female relatives performing that sort of care, because oftentimes they reduce their own hours or they leave work early so that their own children don't have to sacrifice their careers, but that obviously has an impact on their own pensions. And oftentimes we're seeing a rise in the north of sandwich carers, which are carers performing childcare for their grandchildren but also performing social care for their own parents. And the system is similar in the south, where the majority of women that work in the sector or the majority of people that work in the sector are women, and it's also incredibly precarious and low paid. However, there is an upcoming childcare strategy for the first time in the north, and it's supposed to hopefully be published in a couple of weeks, fingers crossed. And there have been some issues with collection, particularly around data actually. For example, the department combined the cost of paid childcare and unpaid childcare, which essentially is free because people are performing it, whether it be parents or grandparents, to demonstrate what the cost of childcare in the north was, which was nearly half the average of what parents actually pay when they do pay for formal childcare. So that issue has been fixed after many conversations with the department officials to say that's not actually how you measure it. I think there's been a bit of a teasing period, but the immediacy of that strategy has really reignited a campaign called Childcare for All, which is co-led by Women's Resource and Development Agency and ECEC in the north, and we're also members of the campaign. There's a variety of different equality sector, women's sector organisations, and we relaunched the campaign in September 2025 in Storm, and basically we outlined 4 pillars of where childcare strategy and work around childcare needs to focus on, which is children, parents, childcare providers, and wider society, because I think sometimes people that don't have children or don't interact with the childcare system yet or not anymore, they feel that that's not a benefit to them. But I think, as we've mentioned before, just as wider gender equality benefits everybody, doesn't matter if you see yourself as an immediate beneficiary, improves childcare and early education, it benefit all of society as well. And we presented a checklist essentially for our MLAs to use when scrutinising the draft strategy. So I figured I'd read out the items on the checklist, because that is sort of our vision for how we'd like to see childcare and early education in the north. So it's all children have access to higher quality childcare that meets their educational and developmental needs in a safe, nurturing environment, supporting them to achieve their full potential, including children with additional needs, including SEN, language barriers, etc. No child is living in poverty as a result of a parent's inability to access or stay in paid work or due to high cost of childcare. All types of childcare settings enabled to deliver high quality, sustainable, accessible childcare across a range of settings through strategic investment by government. The childcare workforce is valued and supported through investment in skills development, workplace progression, and decent pay in terms and conditions. So specific support through the Women's Centre Childcare Fund is to be increased and expanded, as this model best meets the needs of low-income women, especially those who live in areas of increased deprivation. All parents are able to access, stay in, and progress paid work or education and training facilitated by affordable, accessible, and flexible childcare. All parents are supported to undertake the amount of paid work that suits the needs of their family with adequate financial support to live free from poverty. Significant reduction in the gender pay gap and social inequality through ensuring that no one's employment options are constrained by lack of access to affordable, flexible childcare. And economic growth is stimulated through employers having access to a wider pool of skilled, experienced, potential employees for recruitment. So essentially that's our vision, and I think from what I've heard today, it's kind of similar to the vision that is, across Ireland, across Europe. So I don't think we're alone in this, but I do believe that, working within all of our own systems, whether it be at a national level or locally or internationally, it is really important, because we look down south oftentimes and say, look what they have. We look elsewhere as well, but I think we kind of need to bounce off each other, and that's possibly our greatest strength. So really, again, delighted to be here to listen to the rest of the panel.
That's great, thanks very much. Thanks very much for that, Alex, and it was really interesting to hear your vision for the future, because I was going to ask everybody what their vision was, and you're kind of out of that now, but it was great to hear. But I think it was interesting, because I think sometimes we do have the vision that Northern Ireland have a better childcare system than us, so to have that, that the 55 million you said was invested, that's quite shocking, and it just shows you how far we've come in the Republic, although not far enough, I think your point too, Maria, but we have come far and we are getting on that path. So that was really interesting, and I wish you well in 2 weeks' time when your childcare strategy comes out. Hopefully it gives you at least a pathway to your vision. I'm going to now introduce Waithira Burke. Thank you. And she is a community advocate and parent leader based in Wicklow. She's originally from Kenya. She spent over a decade working with local families, schools and communities to support inclusion and belonging for young children. Annie serves on the board of the Greystones Family Resource Centre and plays an active role in parent-led initiatives that strengthen early learning, cultural understanding and family engagement. She brings a strong commitment to creating a supportive environment where all children can thrive. So over to you, Annie.
Thank you so much. And again, just to echo everyone, thank you for the opportunity to contribute to this discussion. I think it's an important discussion that we're having. Unfortunately, my kids are now not in early years anymore. She's 19 and 18, so I'm kind of past that age. But I'm fighting for the people who are coming after me. So I'm going to speak on a migrant perspective as a migrant mother who has navigated island early years and family support system largely on my own. When I arrived in Ireland, I realized very, very quickly that being in a new community, and I had to learn about the new services, I had to learn where to take the kids, what to do, the hospitals and everything else. It's new. And then also the fact that I had to also learn a new cultural way of bringing up my children. Because the way we practice things in Kenya is very, very much different in Ireland. The smallest thing as me yelling at my child in a shopping, you know, when you're going shopping and the child misbehaves and hiding under old dear skirts, and you're not allowed to scream, you're not allowed to smack, you're not allowed to do anything. And like back home, we got a serious beating for the smallest mistakes we made as children. So even trying to navigate that as a migrant woman was quite hard. One of the most biggest challenges faced, especially with early years, is that there is no access to information for migrant women. We don't know where to get the services, we don't know where to get that information. So you find that a lot of times we are depending on, for example, our neighbor telling us something, but if you're new to a community, you're scared of talking to your neighbor, you don't know the person. So even trying to present that was an issue. And then on top of that, there's a language barrier. Because English is not my first language. I know right now I sound somewhat Irish, somewhat English. So my accent is not placed. But at the beginning, with not understanding English comprehension and everything, the language barrier was also an issue. Another major one was the fact that a lot of times, some of our systems back home, you found that a lot of people have the fear and mistrust of systems. So trying to go to ask for help in early years, whether it's a school or anything, we're kind of scared. So it creates that fear and mistrust. So even to mention some of the other challenges is, like everyone has mentioned, and Maria mentioned it, Alex mentioned it, is that a lot of times people who are already Irish and based in Ireland, you have the support system of families. As a migrant mother in a new country with no cousins, no sisters, no family to rely on the days that you're sick, you have no opportunity to look for help. And you can't go to your neighbor because your neighbor obviously has other things that they're doing, so you can't rely on your parent because your parent is back home. So even with that, like, it kind of brings the phrase, it takes a village to raise a child. Back home, you have your whole family next to you. If anything was to go wrong, you have someone to save you. But when you're a migrant and you're in a new country, you actually don't have that support system. And that's why it is imperative to have a public kind of early childhood education, because it means that if, for example, you're in school and your child is in school and it's public, you're not worried that the extra hours will cost you more money. And at that point, you're thinking it's either feeding the family or paying for childcare. Childcare is like having a mini mortgage in Ireland. I don't know if anybody else has experienced that. Like back in the day, I had to pay 1,800 for my child to only be in school for 3 hours. And that's just for them to go in so that they don't feel isolated. They get a sense of belonging and they get to know each of the other children around them. So you find even with that is like, For example, right now, with the system that we have that is direct provision, you're finding that a lot of the parents who have come into the country have finally settled in and maybe have gotten a place, let's say, in a creche or in a school. All of a sudden, you're being told you need to move with little to no notice whatsoever. So you're thinking you've already made your routes to where you have arrived, and all of a sudden you're being thrown in the back ass of nowhere, in the countryside, and you have to restart again. And in that process of asylum seeking, that can happen 3 or 4 times before you actually get your papers. So it's a constant loop. Do you know what I mean? But at the moment, like Darragh said, there is no spaces. There is no early childcare at the moment. The creches are not enough. They have no spaces, nobody to take children in. So then, how do you then expect somebody who's new into the country to even navigate those systems when there's no information, they're new to the country, and no connection? Yeah? Then we kind of talk about the unspoken kind of burden that we feel of we need to constantly prove ourselves. There's this thing where a lot of mothers have that we have to prove that we are the best mothers and we're trying to do all this. You know, that kind of way. So you're working 2 or 3 jobs, especially for those who are migrant single mothers and they don't have that support system. But again, they're playing against a system that is discriminatory and the system that is basically not built for us, if you know what I mean. So automatically, we are 10 steps behind to actually get the help when it comes to early years. So that brings me to the next thing of, so if we really are talking about building an integrated family leave system that is affordable for all, we must also ask, is it truly inclusive? Does it make sure that no child is left behind? Does it meet every family where they're at? Because as Marie said, everything and everyone is at different levels, right? So you're finding that a lot of the people who are going to succeed in early years, if their parents are well educated, they've gone through university, they've gone all through that, they're already at the forefront. But what about the ones like me, who are running from poverty, who are running from persecution, who are running from war? And unfortunately, some of us who have come from the most impoverished communities back home, we haven't had that education or the opportunity to educate. So how do we then expect parents who are at that level, like she said, to actually make sure that our children are at that forefront, to give them that equal footing, right? So in terms of marginalized women, an integrated inclusive system has to be one that is also culturally competent. The people who are providing these services need to be able to provide a service that is truly equal, but also truly cultural aware. It is imperative for us to have a public service. That is a given, that's why we're here. But if we can achieve all that, then it means that regardless of background, religion, ethnicity, location, we have a fair and equal chance to thrive, and for everyone to have that equal footing in terms of, we all know, once you get your 3rd education level and all that, you have a better chance of getting a better job. But how do we create that? By making sure from the earliest age, all children have been given the equal opportunity to actually thrive and grow in our community. So having said that, I'll just leave you with this. It's an African proverb in regards to, for every child who has an education, and for us to empower every woman and every woman in our community, we are actually making sure that the community thrives. So we have to make sure that we give everyone that equal opportunity, and this means having a Together for Public, and that's why we're here today. Thank you.
Thank you so much, Annie, and you made the points very clear. But there's a couple of things I really liked. I liked it all, but there was something you said about, and it resonated with what you said, Alex, about that informal care.
and how we do rely on informal care, and it's the informal care of women who are basically providing this childcare and labour that's not recognised and whatever, and that's, you know, very unfair from a gender point of view and a social justice point of view. But your point was well made that a lot of women who are coming into the country do not have those familial supports, or even further back than before. And you said another point there that I thought was really important too. You said that it's a new system, you don't understand the system, you don't have information around the National Childcare Scheme, around your free ECI year, all those things that we take it for granted if we're living in the country. And this morning I just came from an event that it was a launch of a new research report from about women, lone parents in homelessness. And it was the same type of issue that they only found out, you know, anecdotally how to get services. There was a lack of this kind of safe gatekeeping of who gets access to the information, and those most marginalised don't have access. And they talked about very similar issues that you did, and so that was really relevant to bring that into. So thank you for that. I am now going to go over to our last speaker, Elaine McQuillan, and she is the CEO of Startbright. Startbright is a not-for-profit community service, and they have 7 services that operate in Dublin. She's over 20 years experience in early years education, and she's really passionate about delivering high quality, sustainable community services for children and family in her care. So over to you, Elaine.
Thank you. So I guess a little bit about our organisation. So the model has been around since 2010. When 4 community services that were failing in marginalised areas of southwest Dublin came together due to governance issues, financial issues, and we hear about it all the time that community services are closing down. They have a board of management that's not skilled well enough. It's, you know, made up of people that need to move away because of age or of health, or parents' children leave that preschool and go to primary school or secondary school, and people's lives change. So having all of these different boards of management for single services wasn't sustaining. 4 services in our communities would have failed. So they amalgamated and came together, and we became the model that we are today. We've since increased to 7 services, and I guess the mission that we have in those communities is to improve outcomes for our children and families. So it's a social enterprise kind of approach. It's a community not-for-profit organisation. So we're largely publicly funded. So we're talking about a public system of early childhood education and care. We already have a publicly funded system of early childhood education and care, depending on your postcode, I guess, depends on how much funding you get. So roughly our organisation will get between 75 to 80% of our income is public funds. And then again, 75 to 80% of our outgoings is staff costs. So we rely heavily on government-funded initiatives, capital funding, and small parent fees to survive. So we provide the flexible, affordable, inclusive childcare that we're talking about today. We do complete case studies on our families, and the most recent one was the fee increase that the sector was allowed to get. We looked at the fee increases that we were allowed to get, myself and the board made a decision based on the case studies of our families that we were actually putting them below the poverty line by just charging them an extra fiver that we were allowed. Our fees haven't increased since 2016, and we've been able to grow our organisation and reinvest into staff, careers and capacity of all of our services, and that came from building a skilled board of governance and obviously a senior management team around the services. The flexible, affordable, inclusive has come up a lot today, and I think it's so important in a public system of early years in this country, because not everybody works full time, not everybody can afford full time, and if you go to maybe a corporate service down the road that's open 7 to 6 p.m, you have to pay that fee, and if you don't come for all those hours, you know, you're expected to pay it, and it's too much. Whereas the services that we've developed, if you want to come for 3 hours for, and it's the beginning of our existence, sometimes we were doing the admin for it, but like one of our centres has like 10 sessions, so that they can provide flexible, affordable, inclusive options for our early years children, and also school age childcare as well. what was the other point? Also, the areas that we're in, we have large traveller communities, migrant communities, children that are sponsored by TUSLA for the diverse family needs that we meet, and also children with additional educational needs. There is no provision in the current funding to actually target and support that. 6 out of 7 of our services receive Equal Start funding, which is wonderful. It's closed gaps. We receive now the Blaster for providing meals. We used to provide them ourselves, so now we've got money that we can move elsewhere and provide better services. But the public system that needs to be developed needs to be individual to children and families' needs. Children with additional needs or any other needs that sit outside of providing a preschool education are not catered for, and services like ours in communities are inundated, and you'll hear from lots of community services. Private services don't necessarily take sponsored children or children with additional needs because they don't have the capacity to provide the extra funding and stuff. So I guess while, yes, we're going to talk about what we want to see and other issues, I guess, you know, looking at a model approach, what does that need to look like? You know, we've had discussions with the department as well about who's going to govern this public system of early years. We struggle to govern ours because we need skills. You know, we can build a senior management team around that costs money. We don't want to pay executives to run community organisations, so, and especially not when they're standalone. So, you know, speaking to local county councils or partnerships, the community services are failing, and if we let them fail and we don't have a public system of early years, so many children of non-working families are going to be displaced. So I think that's enough on that.
Elaine, thanks very much for that, and I suppose it was really good for you to speak at the end because you're giving us slight positivity and you're showing us a model that could possibly work and sustainability, and it's great to see 6 out of 7 services getting that early start funding, which is really good. But you raised a really, really important point there when you talked about how the private care model is not supporting sponsored children, the children in sponsorship, whether that's because of TUSLA, because of, you know, additional needs in the home, and that's so important because it can be in many cases preventative of going into full-time foster care, and it's a really secure thing. But it's also around homelessness, like all children in homelessness are supposed to have that sponsorship place. But as we know, in the private model, why would they take a rate less than they could get in the private market? They won't. And what you also have is the concentration of homeless families are all along Garden Street. There aren't enough creches to take all the sponsored, and you have that, you know, whereas private models don't have to take them, and then you're putting it all onto services like yourself, but they're not fit to do it all. So that was a really well made point as well. And it is good to look at that we all want that public for all model, but we have to get it for all and the public model, but we need to start looking at those structures. So thank you for kind of putting the context on that. And I'm going to just start, and I know we've addressed it really in all our speeches we've started talking about, and you can't not, but I'm just going to ask really quickly for one point that you'd like to make around what are the key challenges facing to get to our aim of the public childcare model. So just one point each, and hopefully then we will have 5 different points. So whoever thinks they may not have 5 points and get to the end, so who wants to go first? And who thinks they have 5 points and they will have something new, somebody else says. So 1 point from you, Maria, sorry, I'm kind of biting. Yeah, I'm going to go this way so you can all see where you're coming in the list. So Maria, we come back to you. Oh, sorry. Well, we're going to start with Elaine.
So key challenge, pay and conditions is a massive issue. Like we can open, like the government could open 100 seconds in the morning. Where are they getting staff?
Yeah.
People go to university to build a career. They want career opportunities. Something that we're trying to develop in our services, and it costs us a lot. You know, paying conditions is massive. We're fighting all the time for professional wage. The strategy that the government sets out once a graduate led workforce, you have to only willing to pay 1 per room. Like nothing's matching up here. You want to go, no matter what, if you're level 5, 6 or 7, you went to college, you went to university, people are completing their masters, they're dedicated and passionate about this sector and supporting families and the ever growing change in Ireland that we're in. and then they're leaving the country to go to better paid places, which is their right, but pay and retention is massive. We can have a public system, but
But we need
unless
staff.
the pay matches, you're not going to staff
No,
services.
like, obviously it's a massive point and well made, and thank you, Elaine, and it's great to say it from an employer's point of view. But I'd say Darragh, who's that trade unionist sitting beside you, is kicking himself going, why wasn't he asked that? Because you're just saying his point. But Darragh, you've been doing it long enough, I'm sure you have a second point that you could make.
No, and I think it's really important because Elaine and Startbright is a best in class. It's a model service, does like incredible work, and it shows that there's a huge amount of overlap between unionised early years educators and community providers who are more or less kind of on the same page of everything. There isn't that kind of traditional union employers bite. But just to add it to it, agree with everything Elaine said on it. But at the heart of it is that as long as we have a market-based model of early years, we're going to be here 10 years later, the way he's talking about the same kind of stuff.
No, Darragh.
And I'm not a fan of much like you, but until we tackle that, until we're able to demarketise the system, where private services aren't established on the basis of profit, but on the basis of need of children and families, we're going to be doing seminars like this again and again. So there's a couple of different ways on there. You can do direct provision or state-led provision, or certainly moving to a primary school model where the state runs the wages. Primary schools, if that's state run, everyone thinks, oh, that's the state. They're actually independent boards of management. I think there's a big gap, there's a big overlap between small, possibly a lot of medium-sized private providers, community providers, and the union, a lot of the other groups, of shifting to that primary school model that would ensure that we have good paying conditions to address, to deliver that good quality, but also demarketises the system and gives the power back to, it has to be to the state, of meeting the needs of families and children. Because leaving it up to the market, right, that's not working. It's failing all the stakeholders at the moment. Thanks, Louise.
Brilliant, thank you. Thank you, Darragh. And Alex.
It's maybe more of like a sort of, I don't know, non-tangible sort of thing, but I think like really needs to be, or the main issue I suppose is like transformative, like that, we're in a couple of different conversations today where we talked about how we need like a systems change, and I do think that, well, we're, at least it seems like we're all in agreement of that we have this shared vision of what childcare needs to be looking like in Ireland, that there's obviously some people that just see, well, sure, people will do unpaid care because why wouldn't they? And that is the role of women, and that is, well, they'll, leave their job and reduce their hours and stuff like that. And that's even issues that we've had sometimes in the North in conversations of, we're talking about childcare, social infrastructure, that childcare is worthy of investment, not just piecemeal funding, but that's because we value care and childcare as a whole. And I think for some, that value isn't there. And that's going to be, I think, a real barrier to actually achieving any sort of widespread, truly affordable, accessible childcare system. But I think, I've even noticed that, childcare in the time that I've been in my role has, jumped onto every single political agenda because they know that they can't avoid it anymore. But I suppose what we're trying to avoid is to get a childcare system that doesn't actually do, doesn't service all the specific needs that we've talked about today and more. And for it to be, something, that is, I suppose that's all encompassing, as opposed to something that's what you have you have a couple of free hours of childcare a week now, so you'd be happy you got your childcare. So I think that's, 100%.
Thank you. Annie, next question. What are the barriers you see? Just
Yes.
one big barrier, or even small barrier, any barrier.
One of the biggest one for me would be representation. Again, it's because when you are kind of working on the processes and the systems and how you want to change it, representation is key.
So by that you mean you have to have all the voices at the
All
table?
the voices, yes. Because even if we're here and we're talking about public for all and we want an early years that is suitable for all, we have to make sure that all the voices are actually represented. But even with that, when the system kicks in, representation is key. I need to be able to take a child into, let's say, early years, whether it's ECEC scheme, whether it's primary school or anything like that, seeing a teacher that looks like me, who understands the way I think and things like that, it would make me even be better in what I'm doing. So we have to have representation at every aspect of education. Not just, let's say in university, you're seeing the assistant lecturer who has had to go for PhD and all that, because let's be honest, some of us will never get to that level.
Yeah.
Do you know what I mean? So representation is key.
Perfect.
Yeah.
Maria, you ready?
Oh, barriers.
Yeah.
Well, look, the point that has been made in relation to the representation, I think is a really important one.
You can pick up a new one though.
I do. I just want to make that point in terms of it. And I suppose to get to that representation, you have to dismantle then some of, the structural, the structural issue, the structural inequality that's there. And in doing that, then it is dismantling racism and discrimination. It is looking at an early years education and care system that it's inclusive of all children, that will deliver equality of outcomes for all children. And unless it dismantles that, is representative, that the children see themselves, the parents see themselves in the system, and that it's reflective of their culture, their way of life. And I suppose one of the big things in addressing that, and I think you mentioned it earlier, was that need for cultural competency training that goes, that's informed by anti-racism. Of course, it's an understanding of cultural diversity, but goes deeper into that kind of, what are. So that for me is some of it. And I will make a final point. Moving away from this system, as Darragh have said, that is about the privatisation of, and that is for profit, to actually a system that follows the resource follows the child, in terms of, even just from the get-go, a child that is not entitled to the same amount of hours based on the parent's socio-economic background is not an equal system. It does not ensure equality of outcomes.
And I think you made that point really well at the start, so appreciate that. We are running out of time, and I do want to kind of finish up on time, and I would love to even have 5 minutes with the audience just if there's any pressing issues. But before that, I do want to just really quickly, like 10 seconds as well, 30 seconds each, on what's the importance of having us all coming together with that one strong voice? Because that's what today was about. It was coming together as an alliance, as a group of people saying, enough is enough. We want an equal society, and we want it equal from the start, from a child is born, to have that. And it's great to have these spaces, and I just want your thoughts, every one of you, on what having this space to do together and having that one coherent voice is, even if we can differ about other things, but having that one voice and message. So will I start from you again, Elaine, and go back around? Sure then. I guess what I was thinking of the shared voice of the sector and campaigns like this, we have all of these alliances and collectives and all of that, and we are all working towards the same objective, but we're doing it separately, and collective action has to happen as well. There's a narrative that from joining the Together for Public Alliance, and I noticed it going around a lot, is that narrative of community versus private. Not all community is charity or not-for-profit. They're family-run businesses, they're entrepreneurs starting out on their own. They're not private.
They're not.
They're community, they're private. It's not the we have this thing about the corporate kind of investment into early years and that market driven, but not all private are corporate. So I think allowing and teasing that out more, because I've sat in rooms where the lady has went, well, what's wrong with private? I'm private, but I'm in the heart of my community, and they're not seeing themselves in this thing, and we're not going to get that collective action if people are fighting against, well, I'm community or I'm private. That's not it. It's about that market driven or early years as a right for every child to have access to.
Brilliant, thank you, Elaine. And Darragh?
Yeah, I completely agree with Elaine, and we have to be able to build bridges with private providers as well, those who share the values of this campaign and have the same vision. There's a lot of them out there who are doing really good work for the right reasons. And I think the other thing is that when you talk to politicians and the people who make the big decisions about early years, about childcare, is that they say, well, we're hearing so many different conflicting demands, conflicting agendas, and that united voice of one clear set of demands, this is what we need you to do. That's what's needed, because if they get out the kind of like this interference pattern, right? They don't know what to do. They kind of get stuck, and it's unclear. And if they do one thing, they're going to be pissing off everybody over here. If they do another something, they're going to be, they'll have a club on their hands. So I think we need to expand the coalition greater, and particularly with private providers and more community providers as well, and to kind of further build up that union of early years educators and have just really clear, concrete demands that we're making. That's the only way that we can be effective. We did it back in before the 2019 election. There was big protests, 30,000 people out in the streets. It shifted the dial considerably for early years. There's real tangible results. We have to get back to that space again. We've slipped back.
Okay, thanks, Sarah. And Alex?
Yeah, I think the real strength in this sort of collective working is that, like Darragh was saying, by putting out one sort of agenda, we create the narrative around what we want the childcare, system to look like, as opposed to responding to or reacting to, what government or sort of other actors would prefer it to be, that, not really sort of getting it its due. And I think as well, it normalizes our sort of vision. The more that people talk about it, the more it's like, well, this is the accepted narrative of how childcare should be. We know this is the best practice. And I think as well that the more organisations that are involved in this, whether they be, north, south, whatever, urban, rural, that it ensures that the narrative or vision is truly inclusive of all sort of experiences and needs of the childcare system, and that the vision that we're putting out actually does, touch upon areas which have historically been sort of left behind.
Perfect. Honey.
Thank you so much. So I'll leave you with this. An empty debe makes the most noise. And the reason why I'm using that phrase is to come back to what everyone has said. An empty debe, when the wind comes, it's very easy for it to be blown away. So imagine if that debe has all our voices in it. We are able to actually withstand the strongest storm that comes our way. And that's what's kind of the most important thing is, if we put the same voices in the same place and we're able to march together, it's easier for us to get to where we're going, slowly but surely, to make sure that everything plays into our favor. But we won't be swayed by anything that comes away. We won't be what I call be pacified by the smallest gesture that our government can make. So it's a call to the government that we are no longer going to accept that dummy you're trying to put in our mouth for dripping us that small stuff. It's time that we stood together, strong and firm, where we know that we're going to be able to achieve this in the long run, regardless.
Brilliant, thank you, Annie. That solidarity is so important.
Exactly.
And Maria, last word to you.
Absolutely. Well, I suppose the rationale in terms of engaging in this space and as a collective is about sort of dismantling that divide and conquer piece.
Yes.
From the state, and to be, able to continue to say back to us, as Darragh was saying there, we're hearing this from this and we're hearing that from that, and that kind of, different messaging. So that clear concept. And I suppose within that kind of coalition, that solidarity piece is really significant in terms of recognising the diversity of the children and the families and the parents that they're coming from, and that is informing what new publicly funded, publicly run
Model for all would be. And in that recognising that, not everyone's at the same starting point, but also that there's very distinct needs by particular groups of children, and that target measures alongside of mainstreaming is important. Because we talked about a range of things this morning. When we break that down into the intersectionality of some of that, I mean, a child can be a traveller, they can be homeless. A child can be, with a disability,
so there's all of these intersectional pieces, that it would be really important that the system is built around the needs of the child as opposed to the child having to fit into a system that doesn't recognise them, isn't built for them. Because what you said really struck me, and I suppose it struck me because of the reality of the everyday piece for travellers, for Roma and for other ethnic minorities in this. You're trying to fit into the system that's not built for you. And certainly that system is not reflective of a lot. And so we're moving then to a system with an alliance approach that diversity is to the core of it, and they're the ones informing how it gets shaped as well. So yeah.
And that all piece being crucial. Yeah. Thank you, Mary. I know we don't have a lot of time left, and I feel really bad about that, but if there's even one or two questions or comments, really quickly. There, over there, yeah.